All right. So I'm here today with Joanne Kimball, who is a retired nurse practitioner. Um, she and Trudy Wimmer, another nurse practitioner, were the first that I knew, the first nurse practitioners I knew. I was a church musician at Bethesda Lutheran Church in New Haven at the time in Connecticut. And I met these very nice retired ladies at coffee hour. I had just myself heard about the nurse practitioner profession as I was thinking about going into healthcare as a second career. And Joanne and Trudy really encouraged me and told me lots of interesting stories about the profession. So today I'm here with Joanne, and I'm going to ask a few questions just about how it all started and about the nurse practitioner career. And my goal is to let this inform my leadership roles in California with nurse practitioners and my presentation to Norwegian nurse practitioners who are just starting the profession over there. So, Joanne, thank you so much for joining me today.
Yes.
Um, let's see. When did you first hear about nurse practitioners and why did you decide to become one?
Well, I needed a better position, a better salary. And I had two girls that were actually students at the University of Iowa. So when I visited, I was employed as a staff nurse in a small 50-bed hospital in Iowa. So I had visited them, and then I thought I would go to the nursing office and see what there would be. And then I thought, no, I'll try a physician's assistant, a PA. So first I had a little bit of an interview there, and I realized that it was too much of a commitment and too much of an tuition. Couldn't afford it and all. And so I had not heard about nurse practitioners. Now this is maybe about 1972 or 73. And I walked out, and as I was walking out, the secretary said, maybe you would be interested in this. There is a pediatric nurse practitioner grant, from federal grant, that we will enroll, and maybe you want to try to get into the program there. And it was just off the hand. So she hands me information and an application. And so as we went through the months and working, I turned it in, and I didn't think I had a chance because I was much older. I was, let me see, 47. And I did get in, one of five. And I was actually starting in the nurse practitioner program in 1974. It was one semester. And that meant a commute from my part of Iowa to the middle of the state. And it involved a semester. And every week there would be 2 full days of training. And very, very often late studying and stuff like that. And I'm very frugal, and I stayed overnight with my daughters who had apartments, at student apartments. I think I slept on a couch. I don't know. Anyway, it was mostly studying. And then I had to get back and do a preceptorship and various things. And that had to be organized. And so basically, I probably had 4 days of studying, concentrating, writing and interviewing and doing things that you do. And of course, the program was actually, there were not many, but there were other states that had, of the United States, that had nurse practitioners. The whole program started in Colorado, and I don't remember the years, but they had nurse practitioners before we did in Iowa. Yeah.
So was that first semester a lot of theoretical training and then preceptorship after that, or was it combined?
Was combined.
Okay. Mhm.
I had my preceptorship with a very busy pediatrician in about maybe 35 minutes or so outside of the home I had in Waverly, which is in the northeast part of Iowa. I had to commute to a bigger community, a Waterloo.
And was this outpatient or inpatient or both?
Both. Yeah.
Okay. So you
Mostly,
did.
yeah. And it was 2 full days with your preceptorship. And then there was a part of that I had to do in an outpatient clinic on a hospital in Cedar Rapids. So you can see the program was kind of mixed up.
Mhm.
And you really didn't see your classmates. There was 5 of us in their preceptorship or their clinic work. We were separate in our training.
And were you all training one-on-one with a physician?
Yes. Yeah.
Okay. And then once you finished the program, what was your first job as a nurse practitioner, and what were your main duties? What did you do?
Well, at first I was hired by my preceptorship, Dr. Hansen. And it just sort of fell in order. He had a partner, a younger doctor, who changed and went back to the University of Iowa's medical school and was an instructor. And so Dr. Hansen was rather alone. And I always assumed that he would get another partner, but he stayed. And one time he called the office, kind of a sit down time. And he says, I'm not going to get a partner. We'll just work together. And so my responsibilities were with the school physicals, infant physicals and immunizations, more or less all of the girls and their athletic examinations, patients that he's had for years. Yeah. And then he retired. I'd been with him 3 years and he retired.
And during those early years, were you able to prescribe medications? Was that?
Oh, no.
No.
That was never an offering. Matter of fact, we didn't really review that within my training.
So that wasn't part of that early phase.
No, but eventually through the different programs, it became quite evident that we needed to have a handle on that. For example, I worked in a specialized child health services, and this is in itself, it's a wonderful experience. And it was organized by the state of Iowa, and they did a program was trying to understand medications that could be used for hyperactive children. And so it was a study that we ran, and we had to interview the teacher and the parent, and trying to decide on Ritalin, which was a drug that was preference at that time. So we didn't prescribe, but we were very involved with understanding medications and where there needs to be a change. Yeah.
And then did you have an inpatient role at all in that early phase?
Well, it developed through the years because it was the first program that they had with the specialized child health services. And the state was divided into areas, regions. And I had the west part, and it was Sioux City. And we had our offices in their hospital. And we would run clinics. I don't remember how often, but they would be clinics and with the appointments and everything for children that were at risk of developmental delays. And we followed them. Usually it was from the hospital, understanding that the child had had a difficult birth or was a multiple birth, premature, and we would follow them for at least 3 years. And the appointments was set up. I had a secretary. And way back there, yeah, my secretary did not have computer skills. So they brought her to Iowa City and she had to learn computers. And she came back and Myrna was very good and set appointments. And we also did our own investigative examinations called high risk developmental delays. And they were children that we followed very closely. And I did probably it was like about every 2 months or so, we did a development test. We used a special screening. It was called, I think it was called Denver Developmental Screening for Infants. And it was really very good. And we followed quickly, you know, whether a child was setting up at a certain time, whether they're pulling up and all of that, and scored. And those actually were always, those exams reports were always sent to the primary doctor of the community that this regional department was in.
So you were kind of a consultant and sending reports to their primary doctor?
Oh, yes, yeah.
And did you alternate seeing these patients with your physician colleague, or was this your clinic only?
This was ours. But the University of Iowa, with this new program called Regional Child Health Development, they had, what would you call it, field clinics. And they would send doctors to us, a cardiologist, that we had probably referred them to, you know, and checking the child room, their murmur was way too prevalent, you know, then you do a referral.
So
I
you
got into trouble because I forgot, sometimes, you know, I just set their name in and I forgot to contact their primary doctor.
So you refer directly to specialists at times? Okay.
Yeah.
Cool.
Yeah.
How were you received by doctors and nurses and patients, for that matter, in the early development of the profession? Like, how did they relate to you?
Well, when I was trying to find my preceptorship, I interviewed in Waverly, 3 doctors. And one of them says, oh no, we have way too many women in our office already. We don't need anyone. And the other one says, oh no, we aren't hiring. We you know, we're established here and we don't need another office examining or anything like that. So it wasn't something that they really felt contributed. No.
But the state was driving this program, and because they saw a need, right?
No, they didn't. Of course, you know, everything was so different at that time. Many families never went very often to their doctors in those rural areas, only when they got into trouble or something health-wise. Yeah.
And so for many of these children, you were maybe the only provider that they were seeing, you think, your clinic?
I think so. We made a contact, and it's very important that they keep up. But, you know, parents always do worry whether their child is developing. So there was a lot of worry. So it was really a comfortable position for them to come in and have somebody explain to them what was going to be the next step. And also, we would have many times children that had very, very severe chronic developmental problems, orthopedic or spina bifida, cerebral palsy. And the focus was then to make sure that the community was giving the support. And that was opening a new area for nurses to do within homes, home health and all. So you can kind of sense that everything was kind of getting a different approach for health and families.
That's great. Did you have a community of other nurse practitioners that you knew and worked with? Was there any sort of organization early on, or were you pretty alone?
Back to the University of Iowa, when they were starting this regional child health care, we were actually back in Iowa, the university, developing a new program. For example, sickle cell was not really considered a serious, painful condition. And through their studies within the medical school, they realized that this was a very, very awesome, terrible program for a child developing pain from his circulation with a sickle cell. And so we came back to our particular area in Sioux City at the St. House, and we had a discussion with the emergency room doctors and so like that, asking them to follow up and, you know, introduce this whole idea. And then in like about 1977, the federal law came into effect about child abuse awareness and reporting child abuse within the medical field and other certain. And we were asked to be part of a team called STAT, a state technical, anyway, the focus was that we would travel throughout some parts of the state and preside programs for the different, well, it's medical, like dentistry. I had the responsibility to travel in this particular group team for 2 years and present the program to emergency room nurses who would have need to be following up with in some way a child that came into their hospital and it had definitely had abuse and all like that. And was a very exacting program, you know, how to report, when to follow up and everything like that. It was an awesome reporting job to for people at first, but it's now very much more accepted. But at the time, it wasn't, you know, it was confidential, you know, that wasn't your, you know, yeah.
So it sounds like you had a lot of kind of educational responsibilities early on where you were training and providing, helping develop programs.
Yeah. Yeah. Right. Yes, it was, no matter where you were, you would find, like if I had a different, I had to move and I was in Minnesota and their hospital in Brainerd did not have any position for pediatric nurse practitioners. So I'm working on staff nursing, but then they began to say that they needed to have some way of organizing help for those parents that had children that were in great health needs. So we started a small group there and we met with the parents and had needs addressed and things like that. So I only stayed there 3 years, but you could see that a community that was not really within another state didn't have nurse practitioners, but there was a welcoming need through the hospitals or through others in the community. And that was a time too when daycare was needing to be supervised and improved. You know, there was a scramble when they first started to use daycare that there was no quality and your parents had to sort that out themselves. So we did a lot. And then the states would certify a particular daycare and they had a program like every 3 years, all of the providers had to have training. And that included the CPR for children and infants and choking. You know, it was, well, I thought it was a very good program. And I did that even later in life in Connecticut when I was helping my grandchildren. I contacted the state of Connecticut and they set up a program and I did that. And, you know, I sometimes would work a whole Saturday for 3 hours or sometimes every evening. And we met in the daycare. I mean, it was very easy, but it was that way because they wanted to encourage daycares who were being then certified. Yeah.
Can you think of any barriers that you experienced in the early years of your practice, you know, because it was a young profession?
I think that basically it was with a physician, the pediatricians at the beginning. But when you got to the point where, for example, Iowa has different counties and all of them had their particular, like Black Hawk County and Waterloo had their technical training for daycare providers and for various things. So they always wanted classes for their parents. And I put together for Black Hawk County. I did it for a long time when we were living in outside of Waterloo. What was it called? Something about safety and child rearing or something like that. And I had a program, and it included safety, but was mostly of the various things one should do in vaccinating and looking for a daycare. And it was a program of parents, and it was through their county health service. Yeah. And I actually was working there when I was in that part of Iowa, and I got contacted by the University of Iowa that they wanted to start this program called Specialized Child Health Service. So evidently they were looking at those that graduated from their program and seeing if they couldn't get that started. Yeah. So when you all think about this, it was always one way and then another. It wasn't very exacting. They didn't have anything that they were following. But I felt that the University of Iowa was pretty much a leader once they got started with their program, a very strong program. And they had nurse practitioners from then on with developing and becoming certified. Yeah.
It's been an amazing development, just looking at where the nurse practitioner profession is today, where a lot of American children have a pediatric nurse practitioner as their primary provider, right? I have colleagues here who run clinics, and they are functioning alongside their doctor colleagues.
Yeah. Yes, you're right. Yeah. I know now I'm in this retirement center, and I have friends. I meet often with retired nurses, and we review history and laugh and talk about it and things like that. But anyway, most of them say, well, we all have these health problems. I'm pretty good, but anyway. And they say, I never see my doctor. I am always with my nurse practitioner or my PA. I haven't seen my doctor. I don't know. Maybe he's in another office. I don't see him.
I remember a story you told me back at Bethesda about when you were a young nurse, and when the doctor walked in the room, you had to stand up and curtsy. I think things have changed.
You stood up. And another thing I'll never forget is in training, we had to always be behind the physician in line to the dining room. And they served us on these old metal trays that came from the service.
Yeah, a lot of things have changed since then. It's very interesting to see the growth of the profession here in California as well. We have over 30,000 nurse practitioners now in California. And
Is that right?
We just had some major legislation implemented this last year to allow for a much more independent practice. And they've had prescribing here, since the late 70s. That was one of the big first hurdles for our organization here. So
is that right?
A long way.
Yeah.
What was your favorite thing about being a nurse practitioner?
I think the most important thing was the follow-up that we had from this hospital in St. Luke's Hospital in Sioux City. It was called high risk program or something exam, and our children that newborns who had an APGAR score that was low, or who was multiple births, or a premature, or children that did not feed well, we had an ongoing referral, and I would meet with the parents in a special exam room in the hospital. And it was a follow-up within their staff of the use of a nurse practitioner. And I would check them. It seems like I at least would see them about every other month or something. The whole feeling was the fact, if there was going to be a developmental delay, the earlier you had approached it and understood it and got service and helped the family, which often involved having somebody like physical therapist or something coming to their home. So it was a unique problem that they had. And and of course, it was a very successful problem. And when I was helping my daughter who had premature babies, they had a program in Connecticut. And I can still remember, I didn't say what I was doing. You don't want to make a big statement, say, oh, I did that, so and so. I would be there helping Elise and her brothers, and they'd see if they could set up. They were almost 18 months before they walked, but they had developed, a little hair, a little stronger hair, and were setting up. They were setting up in a high chair by the time they were a year old. Well, Lars, that was not very good, but we had put pillows around them and they sat there. So this is high risk children developmental program in a hospital,
Sounds like you've had a really rewarding and exciting career as being kind of part of the pioneer generation, I think, of the pediatric nurse practitioners here.
Yes, yeah.
Well,
I think
you
all
so
of nursing is that way. I'm
Yep.
sure you remember your mother or something like that. And for example, now in my age, my mother went all the way back to the farm home to have her mother help her with the delivery of me.
Mhm.
There was no hospital that did deliveries or anything like that.
Yeah, we've come a long way.
I know. Yeah,
Well,
and we
thank you.
have a long ways yet in this world to do things right. Yeah, yeah.
Yeah, we do.
Yeah.
And to that effect, I'm very excited for my colleagues in Norway who are developing the profession there as they see new needs in healthcare. So thank you so much for taking time to talk to me today. And I'll be glad to share some of your experiences and insights with my colleagues. All right?
Yes, it'll be fine. Maybe you'll hear a little bit how things go. I would love
Yes,
to.
I will let you know.
All right, Lars. It's been great.